Hi guys, my name's Rachel. I am here to do my introductory video for Public Health Administration. So I grew up on a family-run Christmas tree farm in South St. Louis in the countryside. Part of my dad's family, we all live on here together, and it is fun. It's pretty rural. When I was 15 years old, I went on a trip and I discovered my passion for helping people. I had never been out of the country at that time, and we were working with some Nicaraguan refugees. And I remember thinking, oh my gosh, why are they so dirty? What water do they drink? What are they eating? Where are their parents? And I knew then that I wanted to be a nurse and help others. This is our dog. His name is Skippy. He's 6 years old. He doesn't know he's a dog. He loves playing fetch, hates baths, and waits every night for his little treat bone. I have two younger sisters, Alyssa and Haley. Alyssa's in the middle. She's the one that just got married recently. And my mom is from a very large family, so I have 38 first cousins. And I am proud to say that we are all very close, and it's a good time. So I was doing travel nursing. I came back. My grandmother, she's in the middle, she just celebrated her 93rd birthday party. Her name is Gloria, and she also lives on the farm. And she has dementia, so I came home to help my family take care of her. Some of the things I like to do in my spare time are travel. I like doing volunteer work, cooking, reading, hiking, and what I call adventures. Really some low-key things. In Missouri, I don't know if you guys know this, but every spring it rains a lot, and all of our rivers and creeks and lakes, everything floods, and so it requires a lot of sandbagging to save towns. So about every year I go and sandbag. It's a lot of work shoveling the sand, but it's great to be a part of that community-based initiative and helping others save the town, and you get a good workout in the meantime and you make friends. Recently I went on a trip to Uganda, so one of the things I like to do, I said I like to travel. I went on a mission trip as a volunteer nurse. We hosted a clinic for a community that we have connections with and sustainable development, and these are the Pokot tribe. And this lady on the left, she is blind from a chlamydia infection from birth, and this other lady on the right, I'm not sure how old she is. She doesn't know really either, because they don't have birth certificates. So they do it by events that happen in calendar years, how they can tell time. So they don't have watches, they don't have cell phones. It is very rural. The only people that I've had contact with this tribe are people from UNICEF and WHO. The other thing I like to do is I like to go exploring. So recently I went to Canada, up to Banff, and my friend and I, we were pretty adventurous, but we accidentally hiked a mountain. We took some advice from a local gal working at a store telling us about the best hikes in the area, and so we took her advice, and that meant treading through forests in which they require by law to have 6 or more people in a group because of the grizzly bear activity. And anyways, we ended up hiking up this mountain. We hadn't really prepared for it, but we could actually hear avalanches on the glaciers behind us, and that was really cool and a wonderful experience. So professionally, I am a registered nurse at St. Louis Children's Hospital. I work in the emergency room in an urban area, and I helped open the first ever St. Louis Children's Hospital. It's after hours. It's a convenient care, so it's to bridge the gap between a pediatrician's office and in the emergency room. There's usually no resources for care beyond that for children, and in St. Louis there are not very many urgent cares, and there are no convenient care, so it is the first. And I was a travel nurse in between that time, traveling around the country providing pediatric emergency care in a couple different states, and I really enjoyed that. It's a really great way to meet the country, learn about different practices in healthcare, and how one way is not always the right way, And you also get a different cultural perspective on patients and their diseases. So I graduated from the University of Missouri St. Louis with my nursing degree and a bachelor's in science and nursing. This degree that I'm working on right now for my master's degree in public health is my first master's degree. Prior to that, I went to a community college on a scholarship, and I completed my 2 years there. And my family was very proud that I graduated as a nurse. And there are a couple nurses in my family, but I'm the only pediatric nurse, and I am also the only person who's pursuing public health. I think it's really important that we focus as a group of people in the public health on health promotion and disease prevention. Those are my passions, and I'm really excited to be a part of the public health community, and I hope that I can give back all that they've given to me. Thank you very much.